Like, share, and comment on this video, and check out more videos on this account, Keep Arkansas Legal. You can also find me on Twitter, Parler, and Gab under Keep Arkansas Legal, and my Fundly accounts is Film Local Activism in Arkansas.
Being here today, since we last met, we've had over 1,600 Arkansans that have passed away. So it's very important to us that we continue to get early treatment, very much so. So I appreciate the work that you've done there. I want to ask you if you've considered, Dr. Patil, if we allow pharmacists and others to prescribe this new Merck drug, I don't know how to pronounce it, molnupiravir, the new Merck medication, also ivermectin or budesonide. I really want us to push as much as we can early treatment to keep Arkansans from dying. I think we have failed miserably at early treatment and keeping Arkansans from dying. So do we have any interest moving forward to allow pharmacists to be able to prescribe these things so we can get even more early treatment and keep Arkansans from dying?
So I think the drug has not yet been approved, the Merck drug you're alluding to. Once that's approved, I think the process is as usual with the monoclonal antibodies and vaccines. They're going to ship it out to us, and then we plan to ship it out to various providers, whoever requests it. Whatever based on their scope of practice, they could do that. So if this falls under the purview of various practitioners, they could do that. But I'm not sure what the pharmacy board would allow them to prescribe to. So this is basically a drug. It's like an antiviral drug, just like you have Tamiflu. So it falls under that category, and I'm not sure. I don't know if pharmacists are allowed to prescribe that.
And regarding the Chairman,
other medications that you alluded to was ivermectin. So again, it's not recommended by either FDA or other organizations for use in COVID, but I do know that providers are prescribing it. It's left up to the discretion of the individual provider to do so. I don't think there's any shortage of that either.
Could I just have a quick follow-up, Chairman?
Yes, you're right.
Just to clarify, so I guess I was under the illusion that when it came to the monoclonal antibodies that you all passed or allowed pharmacists to prescribe it. What was the protocol that we went through to allow pharmacists to prescribe the monoclonal antibodies? What body did that? I'm just curious what the process was.
My understanding is I don't think the pharmacists were allowed to prescribe it. They were allowed to dispense it in their pharmacies.
Okay, yeah. That clarified that for me. Thank you, Chairman.
So just to follow up to that, we have processes in place for people that do not have a primary care physician to be connected to a provider if they are requesting monoclonal antibody treatment. So that population is covered, as well as those that have a primary care provider to get the order for the treatment.